Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A physical therapist is reviewing the treatment plan for a patient newly diagnosed with stage 2 lymphedema of the right upper extremity. Which of the following best describes the primary treatment goal for this patient? Option 1. Elevate the limb on pillows while sleeping and apply ice to reduce swelling. Option 2. Initiate intensive manual lymphatic drainage and compression bandaging. Option 3. Apply compression garments during exercise only, removing them when at rest. Option 4. Refer for surgery since the patient will not respond to conservative treatment. Lymphedema is classified into stages based on the severity of tissue changes and the reversibility of swelling. There are 4 stages associated with lymphedema, stages 0 through 3. Each stage carries specific treatment implications, and identifying the correct stage directly guides which interventions should be utilized. Before we look at the options, let's build a clear picture of the lymphedema staging system. Stage 0 is a latent or subclinical stage where lymphatic damage exists but no visible swelling is present. Stage 1 involves early, pitting edema that reduces with elevation. The swelling is still reversible. Stage 2 lymphedema involves established swelling with early to moderate tissue changes, including possible fibrosis. At this stage, elevation alone no longer reduces it. Stage 3, sometimes called lymphostatic elephantiasis, involves severe, irreversible tissue changes with significant fibrosis and skin alterations. The treatment approach must match the stage, and for stage 2, the intensity of intervention needs to match the severity of the condition. Let's explore each of the options. Option 1. Elevate the limb on pillows while sleeping and apply ice to reduce swelling. This option might seem reasonable for early or mild swelling, but it fails on 2 counts for stage 2 lymphedema. While elevation can assist with mild fluid reduction, it is insufficient as a standalone intervention for stage 2 lymphedema. Elevation alone is a stage 1 strategy. It works when swelling is still gravity-dependent and reversible. By stage 2, the tissue changes and early fibrosis mean that simply elevating the limb will not move the fluid effectively. Second, and critically, ice is contraindicated in lymphedema. Vasoconstriction from cold reduces blood flow and impairs lymphatic activity, which can worsen congestion over time rather than relieve it. This is a common misconception. Ice feels like it should reduce swelling, but in lymphedema, it works against the lymphatic system's ability to clear fluid. Option 2. Initiate intensive manual lymphatic drainage and compression bandaging. The primary goal with stage 2 lymphedema is volume reduction and prevention of further tissue damage. Complete decongestive therapy, or CDT, which combines manual lymphatic drainage, multi-layer compression bandaging, therapeutic exercise, and skin care, is the gold standard intervention and is applied intensively during the active reduction phase before transitioning to a maintenance program. CDT is commonly applied in 2 distinct phases: The intensive phase focuses on active volume reduction through daily or near-daily sessions and is combined with multi-layer compression bandaging worn between sessions to sustain the pressure and prevent fluid from reaccumulating. Option 3. Apply compression garments during exercise only, removing them when at rest. Using a compression garment only during exercise is a maintenance phase strategy better suited for Stage 1 lymphedema. Stage 2 requires consistent, multi-layer compression bandaging throughout the intensive phase to sustain pressure and drive fluid reduction between sessions. This option describes an approach that is too passive for Stage 2 lymphedema. Compression garments worn only during exercise represent a maintenance-level intervention, appropriate for patients whose lymphedema is well controlled and who are working to prevent progression. Removing compression at rest during the intensive phase allows fluid to reaccumulate and undermines the progress made during sessions. Option 4. Refer for surgery since the patient will not respond to conservative treatment. Surgical options are considered only after conservative management has failed or in severe Stage 3 cases. This option reflects a significant misunderstanding of lymphedema management. Stage 2 lymphedema is not end-stage disease. It is a well-established indication for CDT, and the majority of Stage 2 patients respond favorably to intensive conservative treatment. Referring for surgery at this stage bypasses the entire evidence-based conservative management pathway and is clinically premature. When we consider the staging framework and match the intervention to the severity of the condition, intensive manual lymphatic drainage and compression bandaging best reflects the appropriate intensity and approach for Stage 2 lymphedema. The correct answer is Option 2. Let's explore the all-student data. 73% of students selected Option 2. Initiate intensive manual lymphatic drainage and compression bandaging. The correct response. 15% of students selected Option 3. Apply compression garments during exercise only, removing them when at rest. 10% of students selected Option 1. Elevate the limb on pillows while sleeping and apply ice to reduce swelling. 2% of students selected Option 4. Refer for surgery since the patient will not respond to conservative treatment. This question is an other systems question, which represents approximately 18% of all exam items. This question is an interventions question, which represents approximately 26% of all exam items. This question is a Level 2 question, since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of Level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Looking to review related academic content? Check out page 564 through 567 in PT Exam, the complete study guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.